So now I would like to introduce our chairperson, Dr. Madhuleka Bhattacharya ma'am. Award, Delhi Women's League, All India Women's Conference, New Delhi 2005, the Indian Geospatial Awards 2005, Dr. D.C. Datta Award for book chapter on HIV in women. And she is also a nodal officer for HIV.
पीछे ले गए क्यों?
उन्होंने बोला, सिक्योरिटी वालों ने।
फोन एत्तवें ब्रदर? हाँ
check, check. Hey, check, check.
ग्लास कुछ किसी को चाहिए।
Andarki Namaskaram.
A very good morning, Honorable Chief Guest, esteemed dignitaries, respected resource persons and delegates, members of the organizing team, and dear audience. I, Dr. Situ,
And myself, Dr. Yadukul.
take immense pride in welcoming one and all to the inaugural ceremony of 50th National Annual Conference of IAPSM 2023, organized by Department of Community and Family Medicine, All India Institute of Medical Sciences, Bibinagar, in collaboration with National Institute of Nutrition, Hyderabad.
Now I invite Honorable Governor of Telangana and Lieutenant Governor of Puducherry, Dr. Tamilisai Soundararajan Madam, onto the dais. I request Dr. Professor Vikas Bhatia, Executive Director, Aiims Bibinagar, and Dr. Hemalata R, Director, NIN, to escort Madam.
With immense pleasure, I request other dignitaries as well to join us at the dais. First, we have Dr. A.M. Kadri, Sir, President-elect of IAPSM, followed by Dr. Purushottam Giri, General Secretary of IAPSM. Can we please have Dr. Neeraj Agarwal, Medical Superintendent, Aiims Bibinagar, and also the organizing chairperson, Iapsmcon, and Dr. Rashmi Kundapur, organizing vice chairperson of the conference, please.
I request Dr. Vikas Bhatia, Executive Director, Aiims Bibinagar, to welcome Honorable Governor of Telangana and Lieutenant Governor of Puducherry, Dr. Tamilisai Soundararajan Madam, with a plant sapling.
I request Dr. N. Arlappa, Scientist F and Deputy Director, NIN Hyderabad, to welcome Dr. Vikas Bhatia, Executive Director, Aiims Bibinagar, and Organizing Chairperson of the conference by presenting a sapling.
Now I request Dr. Gomati R, Joint Secretary, IAPSMCon, to welcome Dr. Hemalata R, Director at NIN Hyderabad.
Now I request Dr. Kishore Yadav, Joint Secretary and Treasurer of the conference, to welcome Dr. A.M. Kadri, the President-elect of IAPSM. I believe he is not there. Can I request Dr. Milli Panda to do the honors, please?
Now I request Dr. Bhushan D. Kamble, Co-Organizing Secretary of the conference, to welcome Dr. Purushottam Giri, General Secretary of IAPSM.
I now call upon Dr. Durgesh Prasad Sahu, Joint Secretary of IAPSMCon, to welcome Dr. Neeraj Agarwal, Sir, Organizing Chairperson, IAPSMCon, by presenting a sapling.
I now request Dr. Vaman Kulkarni, Joint Secretary of the conference, to welcome Dr. Rashmi Kundapur, Organizing Vice Chairman of the conference.
As we are now being graced by distinguished dignitaries on the stage, we now formally commence the event with our national anthem. I request this august gathering to please rise for the same.
अधिनायक जय हे भारत भाग्य विधाता पंजाब पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you, one and all. Now I call upon Dr. Rashmi Kundapur, organizing vice chairperson of this conference, to welcome the gathering.
అందరికీ సుస్వాగతం. ఎల్లరకు స్వాగతం. ఎల్లరిಗೂ స్వాగత. సర్వాన స్వాగతం. Welcome all of you to the Pearl City of India, Hyderabad. It's an honor to have all of you in the gate of South India, which has a great history of Kakatiya dynasty. We are happy to welcome 111 delegates been to this 50th Golden Jubilee Conference of Indian Association of Preventive and Social Medicine, which is an association of 6,780 members working in public health education and public health. On behalf of All India Institute of Medical Science, which is 2 years old, with collaboration with National Institute of Nutrition and Indian Association of Preventive and Social Medicine, I am honored to welcome the Honorable Governor, Dr. Tamilisai Soundararajan, on this auspicious event. Welcome, ma'am. On behalf of Aims, NIN, and IAPSM, I welcome the Executive Director and CEO of All India Institute of Medical Science, Bibinagar, Hyderabad, who spearheads this conference, the 50th National Conference. My cordial welcome to Dr. Hemalata R., Director of NIN, who is also our co-host and being patient to support us in all our endeavors. We have our National President-elect, Dr. A.M. Kandri, who is pulling on this association for the next 1 year. We, on behalf of Aims, NIN and IAPSM, welcome you, sir. My honor to welcome the General Secretary of IAPSM, who is running the show of the 6,780 members of association, Dr. Purushottam Giri, to this endeavor. Welcome you, sir. It's also a pleasure to welcome our own organizing chairperson, Dr. Neeraj Agarwal, who runs the show as medical superintendent, head of the department, and also as organizing chairman of this conference. Of course, my honored welcome to Padma Shri, Dr. C.S. Pandav, who is here with us, who is the name of public health. Welcome you, sir. There are various resource persons from national and international level who have been with us and been supporting us for this conference. I welcome all of you. We have various funding agencies and also partners and technical associations who have supported us for this conference. Welcome you, all of you, on behalf of Aims, NIN, and also IAPSM. Being a member of IAPSM, I am honored to welcome all of you as the delegates who have come from all over the country, from Srinagar top to Kanyakumari down, and from the northeast to the west of Gujarat. We have here the essence of India talking about public health. In 2 days, we will be coming up with a lot of conclusions. Thank you all for coming here and welcome you all, a hearty welcome to Hyderabad to enter into the gate of South India. Welcome one and all. Thank you.
Thank you, ma'am, for the warmest welcome address and guiding us through the proceedings of the conference, a 3-day long academic feast. Now it's time for the auspicious lamp lighting ceremony and to seek the divine blessings of the Almighty before kick-starting the event. I humbly request all the dignitaries on the dais to please proceed for the same.
जय श्री शंकर सुत गणेश, जय श्री शंकर सुत गणेश, नायक दायक सुख, जय जय सिद्धिपते, जय श्री शंकर सुत गणेश। मूषिक वाहन मोदक ग्रासना, मूषिक वाहन मोदक ग्रासन, पालक दासन सुत गिरिजा, जय चंद्र बाल भुज बल विशाल, जय चंद्र बाल भुज बल विशाल, गले अमर माल छवि जाल भरे, जय श्री शंकर सुत गणेश, सुत गणेश, सुत गणेश।
Thank you, Anvita. Thank you, all the dignitaries. Now, I welcome Dr. A.M. Kadri, President-elect of IAPSM, for addressing the gathering.
Honorable Governor of the Telangana and the Lieutenant Governor of Pondicherry, Sri Dr. Tamilisai Soundararajan Madam, dignitaries on the dais, senior faculties, various resource persons, colleagues, and young budding members of the IAPSM. It is really a matter of pride and privilege to be amongst you as a president-elect of IAPSM. In fact, it is a really warming experiences and rejuvenating experiences, because after the 2 years of the COVID, we are now having the in-person conferences and meeting all together and interacting with you all. So really, it is really rejuvenating me. Also, I feel humbled because, humbled being as a president, and on the behalf of the president, I am addressing and delivering presidential speech on the behalf of the IAPSM on the occasion of the Golden Jubilee Conference of the IAPSM. 50th conference, it is not a small thing, I think. It is a milestone for any organization, especially an association, which are scattered, having the member across the India. So definitely, this is a milestone to be celebrated, and it is achieved only and only, I would be saying, by the support of the members of the IAPSM only. So really, we should cheer about this milestone and appreciate each other's efforts in building this association. At the same time, when we are meeting for the celebrating this Golden Jubilee Conference of the IAPSM, I should say that we should come out with the golden vision of the IAPSM for the next 5 years, at least. It is the Amrut Kal. Definitely we are saying that, but we can have the, contribute to the Amrut Kal. Let's, as members of the IAPSM, who are having experience in expertise in preventive and the promoting the health of the people and contributing in the guarding the health of the people, we should definitely work together and contribute to the Amrut Kal, this also. For that, I would be saying that for the next 5 years, let's work as an association at different 5 levels, I would be saying. In the as a part of the Golden Vision, we will be working on the different 5 areas, starting with the individual level, that is the members of the IAPSM. We have worked lots of activities, carried out a lot of activities as an IAPSM over the period of time and provided opportunities. Now we can systemize these opportunities, create an opportunities for the IAPSM as a learner, as a researcher, as an educator, or as an advisor. So we are looking forward to build our association where the opportunities are created for at the individual level. When it comes to the institutional level, also in our vision, we should focus on the different institutes, and largely when we are saying that when we are talking about the IAP and the FOXY, the strength of the IAP and FOXY lies in the private sector because lots of members are there working in the private sector. Our strength as an IAPSM lies in lots of members are working in the medical colleges, government, in the private. I think we should tape it, and that's why we should strengthen our linkages with the medical colleges. We started with the IAPSM World Health Day quiz where we can reach to the 300 medical colleges, and regularly now we are working with the medical colleges, and as a part of sub-national certificate, we have started with the 75 districts, and this year we have contributed as a sub-national certification of the tuberculosis in more than 315 districts with the support of the medical colleges. So that is the thing now, how we can further extend where this we can develop the network of the medical colleges like Incline, which is working for the research, how we can develop the network of the medical colleges across the India as a technical support to the health system and improve the community health of the people. So that is the vision we can develop it. At the state level, now fortunately we are having over the period of time, state chapters everywhere. We have tried to develop the linkages with the state chapters, strengthen the state chapters. Now, as a part of this golden vision, we now strengthen this tie with the state chapters, so the state chapters now meaningfully contribute, because ultimately actions are happening at the state and the below state level. So how we can now develop these linkages? We are looking forward over the 5 years. We will be strengthening our state chapter so that we can contribute directly on the field, in the field of the public community health. And it comes to the national level. National level, over the period of time, we have tried to develop different mechanisms. We are having now, we started with the various committees like MIYC and health education and the tuberculosis and the IPSM E-Connect, something like. So now, we now want to have to institutionalize and build the system at the national level as a part of this vision statement, and develop every year have the action plan for the IAPSM at the national level, and how we can with the state chapter institute and the individually how we can work at this. So building the system and developing the action plan are the two, in fact, at the national level as a part of vision, golden vision, we can work on it. And as we should change the role of the IAPSM head office, instead of the controlling the association at this head office, I would be saying as a facilitator and a propeller of the knowledge and the skills of the community health. And lastly, I will be saying that we should work beyond the IAPSM. We have started collaboration with various development partners, ministry and the NHSRC, etc. But now we have developed further strengthen our role, because NMC, Niti Aayog, ICMR, MOHFW, these are the key players, stakeholders in the community medicine. So along with the developed partners, how we can formalize our relationship and have the more say and the contribute in the shaping the health of the people. So that is at the beyond IAPSM also in the vision document, fifth area I think we can work. So these are the 5, I think, our vision. I would be saying that the golden vision thing we should work upon with the 3 principles. I will be saying one thing is that we should be inclusive in nature. Principles I will be to adopt. It should be a collectiveness, and it should be incremental. Every year we should increment our contributions and work on the IAPSM. With this, I thank the organizing institute for taking up the responsibility for organizing this Golden Jubilee Conference, especially Dr. Vikas Bhatia and his team, and the also NIN team for organizing this conference. I wish all the best for this conference, and thank you very much. Looking forward to have a good academic feast over the 3 days. Thank you very much.
Thank you very much, sir, for your encouraging words regarding IAPSM. It's time for the keynote address, and I invite Professor Dr. Vikas Bhatia, Executive Director, Aiims Bibinagar, and Organizing Chairperson for delivering the same. Sir.
Namaskaram. Good afternoon. What a great moment is this one. Golden Jubilee movement of IAPSM. And the presence of our Honorable Governor and Lieutenant Governor of Puducherry and Governor of Telangana, Dr. Srimati Tamilisai Soundararajan Madam, She is with us to bless on this occasion. There cannot be a better way to celebrate the Golden Jubilee Conference of IAPSM. When we have a governor, we have a women reflecting the Nari Shakti of our nation. We have a person who by profession is a doctor, is a gynecologist. And ladies and gentlemen, the young boys and girls and all the delegates who have come from all over the country, they may have heard about our governor. But today, we are very happy that we are able to meet physically, come together. And I want to give my congratulations to about 1,000 delegates who have come from all over the country, public health professional. After winning a war, you all are COVID winners, COVID warriors. Please give a big clap. In 2019, ma'am, I was at Aiims Bibinagar, and that time the organization told that you please do this conference at Bhubaneswar Aiims. And the COVID was just starting, early days of COVID, and we were just counting the situation which we have now, almost finished. That was the beginning point. That was December, January 2019. And we were planning and thinking. But then I got a new assignment, I shifted here, and I requested my friends to please do it. But because of the COVID, the situation changed altogether. And the people, my friends, my delegates who were to meet, they could not see each other. We were looking at each other on mobiles, on WhatsApp, or online. Everything changed in the world. And all of you all have come from, I think, almost all states and union territories of the country were working and fighting, and many of us, our own friends, our own colleagues have lost their lives. Ma'am, this is such a emotional moment that all my friends, my colleagues, and particularly the youngsters who are looking at us, that how we took this fight. So when we planned for this meeting, this conference, we were thinking what should be the theme. We were discussing with our colleagues in Aiims Bibinagar, and then it came to our mind that the time has come. 50 years we have spent on various aspects. Now time has come to think, do the introspection that how we can face such situations in the future. Such public health challenges and emergencies will keep emerging. New and new neglected diseases are also needs to be addressed. And let's think in a different way, have the innovations. And because it is one planet, we have seen the real impact, the effect of the COVID pandemic, that how it can spread all over the world. It's one planet, one earth, our Mother Earth, and it is one health. So that's what the theme is. This is how we all have to work together. Our IAPSM president has told about One Health and work together. Thank you very much, ma'am, for your presence here, for blessing us. Madam has always been our strength in supporting us, helping us, and guiding us in making of Aiims Bibinagar, which is a little away. We don't have our auditorium. So we are thankful to our Director NIN for helping us and extending the full support. And I once again welcome all the delegates to Hyderabad. And there is a big delegation which has come from Kashmir also, and from this, or from the Tamil Nadu, so from east and west, north, and from every part of the country, we all are assembling. I am sure you all will enjoy these moments. Thank you very much. Thank you, ma'am.
Thank you, sir, for that insightful keynote speech. I would now like to invite onto the lectern Dr. Purushottam Giri, General Secretary of IAPSM, for officially announcing the results of various awards and fellowship for the year 2022-23 in the field of community medicine.
Dignitaries on the dais, Her Excellency Honorable Dr. Tamilisai Soundararajan, Governor of Telangana, Dr. Vikas Bhatia, Director Aiims Bibinagar, Dr. Hemlata, Director NIN Hyderabad, Dr. Harivansh Chopra, our National President, IAPSM, but he who could not come to attend this conference due to his health issue. I know that we all are definitely going to miss him on every occasion in this conference. We are lucky to have Dr. A.M. Kadri, President-elect, with us representing the President and fulfilling his duties. Dr. Neeraj Agrawal, Organizing Chairperson, Dr. Rashmi Kundapurkar, and Dr. Mili Panda, Organizing Secretary of this conference. Senior faculties of Community Medicine, public health experts, postgraduate students, my colleagues, dear delegates, ladies and gentlemen. First of all, at the outset, being a Secretary General of National IAPSM, I extend my warm greetings to one and all present here on behalf of IAPSM headquarters, and also take this opportunity to welcome you all for this grand 50th, that is a Golden Jubilee Annual National Conference of IAPSM at Aiims Bibinagar in collaboration with the NIN Hyderabad. It is noteworthy that the conference focused on the thoughtfully chosen theme, that is introspection and innovation in public health, one planet, one health, with many sub-themes of the public health importance. And I am sure that the deliberation in this conference will ignite the minds of community medicine specialists, public health experts, medical students, and academicians to chart out the intricacies involved in the theme. I am happy to share with you all that as on today, till 31st January 2023, total IAPSM life membership is near 7,300. And in this year, there is a phenomenal increase in the IAPSM membership in the last 10 months. That is 740 new members joined our IAPSM family. That is a 10th of the total strength of the members. And I humble request to all the senior members and head of the departments to motivate the colleagues and new postgrad students to join the IAPSM family. And let us make the history by making 1,000 till remaining 2 more months, that is 31st March 2023. Now it's matter of great honor and pleasure to be here on this stage for such an important momentous occasion in which the members of the IAPSM with a substantial contribution in the subject are given the recognition as a fellow of IAPSM, that is FIPSM. As per the proceeding of the General Body Meeting of IAPSM held in 3rd March 2022 during the 49th National Conference, which is held at Government Medical College Nagpur in Maharashtra, there the 12 IAPSM life members have been selected as awardee for the prestigious fellowship in IAPSM for based on their substantial contribution in the subject and evaluation on set criteria. It gives me immense pleasure to request Her Excellency Honorable Madam Dr. Tamilisai Soundararajan and dignitaries on the dais to please come forward and present the memento and certificates to the awardee on this grand occasion. I invite on to the, first of all, Dr. S. Salim Muhammad Salim Khan, Professor Head, Department of Community Medicine, Government Medical College, Srinagar, Jammu. I request all the dignitaries on the dais, please come forward and present the moment. Dr. Rajiv Kumar Gupta, Professor and Head, Department of Community Medicine, Government Medical College, Jammu. I request Dr. Pankaj Bharadwaj, Additional Professor, Department of Community Medicine, Aiims Jodhpur, Rajasthan, and he is also the Chief Editor of our journal, Indian Journal of Community Medicine of IAPSM. Myself, Dr. Purushottam Giri, Professor Head, Department of Community Medicine, Indian Institute of Medical Science and Research, Medical College, Jalna, Aurangabad, Maharashtra, and also the Secretary General of IAPSM. The next, Dr. Rakesh Bahal, Professor, Department of Community Medicine, Government Medical College, Jammu, and he is also Executive Council member of IAPSM from North Zone. Please join me in applauding for FIPSM awardee, please. Next is Dr. Arun Kumar Yadav, Professor, Department of Community Medicine, Armed Force Medical College, Pune, Maharashtra. Next, Dr. Professor Ashok Kumar, Department of Hospital Administration, PGIMER, Chandigarh, Punjab. Next, Dr. Rashmi Sharma, Professor, Department of Community Medicine, GMERS Medical College, Sola, Ahmedabad, Gujarat. Please, big round of applause. Next, Dr. S.K. Singh, Professor, Department of Community Medicine, KG Medical University, Lucknow, Uttar Pradesh. Dr. Sangeeta Kansal, Professor, Department of Community Medicine, Institute of Medical Sciences, Banaras Hindu University, BHU, Uttar Pradesh. Dr. Neelam Anupam Topo, Professor, Department of Community Medicine, Netaji Subhash Chandra Bose Medical College, Jabalpur, Madhya Pradesh. Dr. Parag Kumar Chawda, Assistant Professor, Department of Community Medicine, GMERS Medical College, Gotri, Vadodara, Gujarat. And he is also the coordinator for eConnect, that is the online academic platform for IPSM. With Parag Kumar Chawda. Thank you, all the dignitaries. With this award, this brings to me the end of the award session. Ma'am, Her Excellency, we are very grateful to have you here for this event, and we appreciate your graceful presence on the behalf of Indian Association of Preventive and Social Medicine, and thank you for sparing time to felicitate our awardee. I wholeheartedly appreciate and congratulate the efforts of Professor Dr. Vikas Bhatia, Dr. Neeraj Agrawal, Dr. Mili Panda, Dr. Rashmi, Department of Community Medicine and Family Medicine, Aiims Hyderabad, their whole team for the such grand Golden Jubilee Conference. At the end of this 3 days conference, I am sure that the deliberation in this conference will succeed in the walk of the path for improving the various soft skills of the faculties, students in the field of community medicine and public health. It will prove to be a grand event for all of us. Last but not the least, I wish all the delegates an enjoyable learning experience in the conference, and I also extend my best wishes for the grand success of the conference. Before I finish my talk, I would like to recite only 4 lines. हिंदी में बोलता हूँ. मेरे अक्स पर आप सबका साया है, मेरे अक्स पर आप सबका साया है, मैं जो कुछ भी हूँ आप सब ने मिलकर बनाया है. मेरे अक्स पर आप सबका साया है, मैं जो कुछ भी हूँ आप सब ने मिलकर बनाया है. आपके साथ मिलकर, आपके साथ चलकर IAPSM को नए शिखर पर पहुँचाना है. With this, I hand over the stage to the organizer. Thank you very much. Jai Hind, Jai Bharat, long live IAPSM. Thank you.
Thank you, sir. Can we have a big round of applause for all the awardees? Thank you, everyone. Without any further delay, I invite Dr. Bhushan Kamble, co-organizing secretary of the conference, to introduce our esteemed chief guest, Honorable Governor of Telangana and Lieutenant Governor of Puducherry, Dr. Tamilisai Soundararajan, Madam.
Good morning, all. It's my honor to introduce our today's chief guest. Today's chief guest, Her Highness Governor of Telangana and Lieutenant Governor of Puducherry, Dr. Tamilisai Soundararajan, Madam. Madam is a physician turned politician who, after completing her MBBS and post-graduation in gynecology, underwent special training in ultrasound and fetal therapy at Canada. She nurtures great devotion towards public service and enhancement of living standards of common people with a focus on health and education as a prime agenda. Madam is a proud recipient of an international award titled International Rising Star of the Year 2018 by Multi-Ethnic Advisory Task Force USA. Her contributions in the various fields include holding the office of Vice President of Tamil Literary Forum, authoring 2 medical textbooks including Guidelines to Sonology. Madam has authored 2 books on our Honorable Prime Minister Shri Narendra Modi ji. First one is Achievement of Modi ji and second one is Modi ji's Sri Lankan visit in Tamil language. She has contributed several literary as political articles in Tamil, and English magazines. Her social service activities include women empowerment, preventive health programs, and medical camps for women. Madam has held office of the Director of Bharat Petroleum Corporation of India till September 2019. She took charge as a Governor of Telangana in September 2019, and it's very honor to say that she is the first woman to hold this office. May I take privilege in inviting respected Governor Madam Dr. Tamilisai Soundararajan to address the auspicious gathering. Please, ma'am.
A special good morning to each and everyone here. Dr. Vikas Bhatia, Executive Director, Aiims Bibinagar, and patron and organizing chairperson of the conference. First of all, I congratulate him, very energetic person, and after he came as the director of Aiims of Bibinagar, there is tremendous improvement in the management. And when I went first to Aiims, his service during COVID is something to be mentioned here. Congratulate him. And Dr. Hemalata, Director, National Institute of Nutrition and co-patron of this conference. And I should congratulate you and compliment her because she has been associated with Raj Bhavan in the management of anemia, which is prevalent among the tribal groups. And we continuously, she attended the meetings at Raj Bhavan, and the project we took forward to manage the anemia, nutritional defects among the tribals. Actually, it was very much appreciated during the governors' conference, which was held at Delhi. So I should compliment her. And we have some future projects also with the National Institute of Nutrition. And Dr. Harivansh Chopra, President, Indian Association of Preventive and Social Medicine. Dr. Purushottam Giri, General Secretary, Indian Association of Preventive and Social Medicine. Dr. Neeraj Agarwal, Medical Superintendent. Dr. Bhanu Prakash Reddy, Head Division of Biochemistry, NIN. Dr. J.J. Badu Geddam. Babu, sorry, it is spelling mistake is here. Babu Geddam, Head Clinical Epidemiology, NIN. Major General Professor Atul Kotwal, Executive Director, National Health System and Resource Center. Dr. Sudarshan Mandal, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke. Dr. Manohar, Additional Secretary, Department of Health and Family Welfare. And Dr. Batmashri, Dr. Pandav. And really I appreciate his presence in spite of his ill health. And I heard he has been awarded Batmashri for his work on iodine. And really I appreciate your presence, sir. And Dr. Simula Garg, madam, for her presence. And as I already mentioned, Dr. Major Kotwal for his presence here. And all the delegates who have come from all over the states, from Kashmir to Kanyakumari. And I am really happy to attend this program. First of all, I apologize. I could land here a little late because I came from Puducherry and through Chennai, and I landed here. And I am very happy that I am addressing the conference of the stalwarts and the delegates, the professors, the academicians of the social and preventive medicine. During pandemic, as it is mentioned by the director Aiims, your work during the pandemic is something laudable and the extraordinary work to be mentioned and appreciated here. As persons of family medicine and experts of social and preventive medicine, you take the message to the people directly than any other specialist. Actually, I have to say my son is also a specialist in social and preventive medicine. And his father is a known nephrologist. And when we wanted to take him a clinical subject, but he was very passionate, he wanted to take only social and preventive medicine, and he is working as an assistant professor at Coimbatore in the PSG Medical College. He wanted to come here, but recently he is blessed with a girl child. So because of that, he is unable to come here. So why I am telling you are all part of my family, because my son is a preventive medicine specialist. And I always think, even during our medical college, the message of the prevention, the message of the disease are directly taken to the public by the preventive medicine specialist. This gives confidence. Making them aware is the best part of our profession. I always think, because the creating awareness among the public is the most difficult one than treating them, and making aware of them about the treatments. And when I was the house surgeon at Tanjavur Medical College, we used to find anemia among the public, the pregnant women, and when we prescribe iron tablets to them, when we go out during the lunch hour, we used to see the iron tablets thrown in the ground. We used to pick them up and call the patients and used to ask him, why you threw the iron tablets like this? They used to tell, already we are black in color. So if we take the iron tablets, my child will be black in color. So my mother-in-law will scold me. So we have not taken. So in the lighter sense, when I was addressing a pharmacological conference, I told, please produce iron tablets in multicolored. Because like saris in multicolors, women will like only multicolors. So if we are producing black color iron tablets, they are not taking. So this is the kind of awareness, because we must know the pulse of the patient. Just like that, we cannot be writing the prescriptions. And as a doctor, I have found so many times, we used to take the paper and we have to write the prescriptions. But most of the time, we won't be able to know the price of it. I always say, because I laud our Honorable Prime Minister because of the generic medical shops, Jan Aushad, because the charges of the cost of the medicines are much lower. So identifying the problem which the people are suffering from. We used to write hypertension tablet, but when the patient go to the pharmacy and ask the price of the hypertension tablet, the hypertension will shoot up because seeing the price. And when we write for ulcer tablets, when they hear the charge of the cost of the ulcer tablets, it will be intensified. So preventive medicine is something, not only prevention, making the people aware and creating awareness. And as doctors, we always know that we can face the challenges than any other person. For example, when I became the governor, I have narrated this in various medical conferences. When I became the governor of Telangana, I am the youngest governor in the country. And most of the people commented, oh, she is a lady governor and she has been posted as the governor of the youngest state, newborn state, Telangana. How she is going to manage. Then I told, I am a gynecologist. Because I am a gynecologist, I can handle newborn babies. So Telangana is a newborn state, so I can handle it. So when I was given an additional charge of Puducherry to manage the administration at Puducherry, same critics came forward and asked, oh, okay, she managed Telangana. How she is going to manage Puducherry? Again I told, as a gynecologist, I can manage if a singleton is born, I can manage if twin babies are also born. So that confidence is given to me by my profession and my career as a gynecologist. So as doctors, even during the COVID, because of the doctors and because of the awareness and because of they were facing the challenges. So only when some of the doctors were admitted during COVID here, when the doctors were on panic, I wore PPE and went to the hospitals and gave hope to them so that they are the saviors. And because of that, most of the doctors gain confidence. So a doctor, governor is wearing the PPE and coming to the hospital. So we have to be more courageous because we have the support of the governor itself. So that is the message. So whatever may be the situation, my appeal is making the people aware. Because even now, it's a 130 crore population, and we are very happy, I am very confident that we have taken our indigenous vaccination, which was the dream of like medical students during our medical student days. We used to be longing for the vaccines to be imported from other countries. But now we are very happy and proud that we have taken our vaccination, and our vaccination has been administered in more than 150 countries, and we have exported our vaccination because of the dedication and sacrifice of our scientists. So each and every branch to be dealt in a different way, particularly creating awareness among the public. Whatever may be the challenges and whatever may be the advancement. For example, stroke. Before we know cardiac attack is known to everyone, but brain attack is not known to others in the way where cardiac arrests are now known. So creating because that golden hour, we have to reach out during the golden hour. And the preventive medicine, when I went to Puducherry, the Vector Control Institute, they were telling because of the mosquito bite and because of the problems, we are having so much of research activities. But most of the clinicians are unable to get the information correctly. So in a lighter sense, I told you are the specialist, because even the lion, we can hold the lion in a net, but afraid of mosquito, we are all sleeping inside a net, afraid of the mosquitoes. So you are very successful in confining the human being in a net, then we cannot confine even a very big animal in the net. So this is the type of education and the message you convey to the people, how all these contagious diseases, communicable diseases are more prevalent among the people, and your presence will be more appreciated, because after the pandemic, it will be rare to see a situation without pandemic. Somehow, there will be some communicable diseases. Somehow, there will be some part of the world, as it is very clearly said, one earth, one health. And as our director told, it is almost mimicking the motto of the message of the G20 conference. So you have a world thinking, so that I can say, because before that G20 you have thought about the one earth and one health. Apart from that, my request is, even though the clinicians directly they are super specialists and they are communicating with the people, but the main responsibility is taken by you, because you are the primary people who are working on the communication of the disease. We are working on the making awareness among the public, and you are working on the social medicine, which is very important. And I should appreciate Aiims director, because they are taking so much of social causes like fluorosis. Actually, when they were studying fluorosis, so I request them, what are the regional problems which are prevalent in Telangana, so that they can take the message from the villages, because some parts renal stone is more prevalent. Incidence of renal stone more in some of the parts of the Telangana. Some of the areas CKD is more. They don't know the cause. So such as social and preventive specialist, my request is take the regional cause, even though we are research oriented, particularly some regional areas. We don't know what's the cause, but there are some people suffering from particular disease in certain areas. So we have to concentrate on that, and I always feel making the public aware of the disease is the most important thing. Whatever may be the improvement, whatever may be the inventions, whatever may be the innovative procedures. Because I should say, when I was practicing sonology at Tanjavur Medical College, that was the time when ultrasound was invented. So when a person came for prostatic study, I told him, please come with full urine so that tomorrow I can study your prostate. Next day, there's a village person came and he opened a yellow bag and put one Horlicks bottle with full of urine, second bottle, third bottle, and he told, you only asked me to come with full urine. So this kind of message, because this is the responsibility of the social and preventive medicine personalities, the specialists. I can narrate another story, because when I was a house surgeon at Tanjavur Medical College, twin babies were born. One was male and one was female. And as you know, the twins need constant checkups, investigations, monitoring. So when the mother brought the children next month for monitoring to assess the growth, the girl child was low in weight. Both were the same weight, 2.5 kg. The girl child was lower and the boy child was gaining the weight, but the girl child was losing its weight. Next month, same monitoring, we monitored the children, same findings were there, where the girl child was losing her weight and the male child was gaining the weight. All investigations were done. All investigations were within normal limits. Then we were asking the questions to the mother. Suddenly we asked, you are having twin children, and do you have adequate milk to feed the children? The answer she told was very much surprising, and she told, I am giving mother's milk to my male child and I am giving diluted cow's milk to the female child. So they wanted the male child to grow properly than the female child. So this is the responsibility of the social people, social specialists, to make them aware. There could not be any difference between the gender difference between the children, and there should be awareness about the mother's milk, and there should be awareness about the other alternate medicines or alternate nutritional aspects. So these are all the things we have to think it in our mind, and apart from our research activities, reaching the final person, creating awareness among the common public could be the main message of our conference. And I really appreciate your presence, and I welcome to the Pearl City. Enjoy the Hyderabad biryani and enjoy all the tourist heritage centers so that you can visit them. And I welcome you to Hyderabad, and as a doctor turned governor, I am very proud to inaugurate this conference, and you are the most responsible people to create awareness and take the message to the people directly than any other specialist. Thank you so much.
Thank you, madam, for your encouraging words and pressing on the importance of prevention in healthcare. All I can say is we are very proud to have the youngest governor in our country.
Next in our agenda, we have the release of e-souvenir that encompasses the very essence of this conference.
And to do the honors, we request Honorable Governor Madam to kindly give permission to release the e-souvenir.
now proceed on to the felicitations.
I humbly request Dr. Professor Vikas Bhatia sir, Executive Director, Aiims Bibinagar, to felicitate our Honorable Governor Madam and hand over the token of appreciation.
I request all the dignitaries to join, please. Can we have a big round of applause? I now request Dr. Neeraj Agarwal, Organizing Chairperson of the conference, and Dr. J.J. Babu, Vice Chairperson of the conference, Scientist F and Head of Clinical Epidemiology Division, NIN, to felicitate Dr. Vikas Bhatia, sir. Dr. Neeraj sir and Dr. J.J. Babu sir to felicitate Dr. Vikas Bhatia, sir.
May I now request Dr. Rashmi Kundapur, Organizing Vice Chairperson, and Dr. Govind K. to felicitate Dr. Hemalata R., Director, NIN, Hyderabad.
Once again, I request Dr. Neeraj Agarwal, Organizing Chairperson, along with Dr. Mili Panda, Organizing Secretary of the conference, to felicitate Dr. A.M. Kadri, sir, the President-elect of IAPSM.
I request Neeraj sir and Dr. Mili to kindly felicitate Dr. Purushottam Giri, General Secretary of IAPSM.
With this, we have come to the end of this inaugural ceremony of the 50th Annual National Conference of IAPSM. I call upon Dr. Mili Panda, Organizing Secretary, to propose the vote of thanks.
A very good afternoon. Today's event is memorable since it marks the beginning of the Golden Jubilee IAPSM conference. And what best than to get it inaugurated by Honorable Governor Madam? I take immense pleasure in thanking Honorable Madam for sharing her motivating experiences and inspiring us to tread the path for service to humanity. Thank you, Madam. On behalf of the entire conference organizing team, I would like to extend heartfelt gratitude to President-elect IAPSM, Sir Dr. A.M. Kadri, General Secretary, Dr. Purushottam Giri, and IAPSM office bearers. You have helped the organization at every step, so thank you so much. And from the bottom of my heart, and on behalf of the entire Aiims Bibinagar fraternity, we specifically thank Team NIN and their staff for their unsolicited support and for being our coordinating partners. Thank you so much. I definitely need to thank our support staff, volunteers, development and technical partners who helped us directly or indirectly. And lastly, you delegates who kept us motivated to keep striving for our best. Thank you all, and welcome once again to the Golden Jubilee IAPSM Conference 2023.
Thank you, Dr. Melli. Before signing off, we once again request all the dignitaries on and off the dais and the audience to rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Jai Hind. Thank you.
Thank you very much, madam.
Thank you all. We are running 20 minutes late, that's it. But I'm just going to give you all a 10 minutes break because we've been sitting long, and at 1 sharply we will be starting the next session with a late lunch because you have a heavy breakfast, you will have a heavy high tea now. At 1 sharply we will start, but we'll have a late lunch break. So please, with the signing off right now, we'll be back here at 1 o'clock for a very important session. So please be back at 1:5 and the lunch will be a little late lunch. Thank you.